One thing that people don't think about as they're going through their day-to-day life is that we do a lot of things sitting. Like whenever we're sitting to go to work, we're sitting while we're at work, we're sitting to go back home from work. Your hip flexors don't have to do much whenever you're sitting. If you're thinking about the positioning of where your hip flexors are at on the front portions of your hips, and then imagine a sitting position, those hip flexors are gonna get really, really tight. And that's a majority of the reason why a lot of our patients come in with tight hip flexors is because of our lifestyle. My name is Jonathan Zalamea. I'm a primary care sports medicine doctor out of Cypress, Texas. Whenever I talk about prevention for hip flexor issues, I actually usually recommend for patients to transition from a seated to standing desk and then alternate so that way that your hip flexors can get some nice mobility in. Whenever we transition from in-office situations to at-home situations, I had to ask patients to stop doing their work off the couch or in their bedroom and make sure that they have a true office situation to work in. Whenever it comes to prevention of hip flexor tightness, I usually recommend for patients to do two different things. One focusing on lifestyle, the other focusing on exercises for prevention. Whenever it comes to lifestyle, it's just being conscious of what you're doing throughout the day and making sure that you transition from sitting to standing often. And then whenever it comes to exercise, it's not just the typical stretches, but also activity can be helpful. So making sure that you're going for walks or doing some type of cardiovascular exercise to get the blood flowing. With the blood flowing, it can make it to where a lot of the muscles throughout your body, including your hip flexors, become a lot more loose and make it to where you don't have as much of that issue with the tightness and then therefore back problems and all these other issues that come with hip flexor tightness. Whenever it comes to stretches to prevent hip flexor tightness, I usually recommend patients to do three different things. Two focus on the hip flexor, one focus on the opposite side. So whenever it comes to the two stretches, I usually recommend patients doing a standing quad stretch where you stand up and then you grab your foot behind you and pull. And then number two would be lunges. Whenever you lunge forward, the leg that's further back gets nice and stretched out. And then number three is to never forget the opposite side. There's a reason why we focus in on therapy on making sure that your muscles are balancing one another. So making sure that you're also working on hamstring stretching exercises is important. So like bending forward, grabbing your toes if you can be very helpful.